So the listening test has three sections, as all of you are aware. A has 24 questions. This forms the major chunk because the total number of questions you have is 42. So more than half of the question in listening are from part A. You have 6 questions in part B and you have 12 questions in part C. As the test progresses, the difficulty level increases, which means part A happens to be the easiest one and part C happens to be the toughest section of the test. Okay? Provided that you are aware about the types of questions and you have practiced enough in this test, the listening module happens to be the easiest module. Very rarely a student would fail in the listening test. Most of the students are able to make B level in the listening test. The only thing you should be focusing on when it comes to listening is improving your familiarity of different accents, because when it comes to the listening test, you can have all the foreign accents and you should be able to understand the sounds produced by different speakers from different background or from different countries or having different accents. Now, the focus for today's session is part A and part B. We'll be doing a thorough practice of part A, where we would be doing the pre-listening section. How can you prepare yourself better for the pre-listening part? Then we will be also looking at part B, different types of questions that you can get in part B, and how can you be better prepared to listen for the listening part B as well. So pre-listening is going to be our main focus today, how to utilize the time that you're getting before listening. So let's get started with part A first. You have two extracts in part A. Each of the extract will have a consultation. That consultation can be between a patient and any of the healthcare professional. It could be a doctor, nurse, physiotherapist, dentist, occupational therapist, pharmacist. But more often, you see the doctor patient or nurse patient consultations. So you can expect at least out of two extracts, one would be either a doctor patient or a nurse patient, and another extract could be from the other specialities. And when I say doctor, doctor itself has a lot of specialty within it. So you can expect all those specialities, being included in the listening part A section. Now, what is happening in the listening part is, imagine that you are a junior doctor and today is your first day, okay, in the clinical practice, and you're sitting in the cubicle where a consultant, a senior consultant, is interviewing the patient during the consultation, and the senior consultant has asked you to take notes on the consultation that is going on. Okay, so what notes would you take, or what all information would you note in your case paper if you are going to listen to a patient who is describing a health problem? Can you all type that for me in the chat box? You are a junior doctor or a junior nurse or a student nurse who is sitting in a cubicle where a senior consultant is interviewing a patient, and the consultant has told you to take notes on the consultation. What all points would you include in your notes? Could you type the topics for me? Yeah, it could be history, it could be presenting complaints. Okay, what else? And when we say presenting complaints, we would be asking all the details of presenting complaints, right? It could be, yeah, it could be the duration, nature of complaint that they are having, if they have got any tests done. Yeah, it could be any personal or social history if that's important. What treatment have they taken, if they have self-treated this condition, or have they taken any OTC, that is over the counter medication, have they consulted anyone, definitely the laboratory findings, if they have had any tests so far. So these all factors that you're mentioning just now will be more often the subheadings of the notes that you will have or that you will encounter in the listening part A. Let me show you one of the question papers so that you can better relate to what I was just discussing. Here it is. Okay. You will always have the context sentence at the top. This is very important because it kind of gives you an idea as to who is that senior consultant. Okay. So here it says they are a nephrologist. Okay, and you need to take notes in a word or a short phrase. Why is that so? Is because the notes are already taken, but there are gaps in it, and you need to fill in those gaps. Yes, and do you see all those subheadings are something that you had already predicted? The investigations for initial treatment that they have taken for the treatment options. So you look at the context sentence first. As soon as you look at the context sentence, you send a message to your brain that you please be ready with all the vocabularies related to nephrology. Yes, all the tests done in the nephrology. What are the common signs and symptoms that we see in a patient who has issues related to kidney? What are the common medications? What are the common therapies or treatments or surgeries? What are the common points from the personal or the social history that we look for? So this context sentence is an alert message for your brain. I often tell you that whenever I say underline keywords, underlining keywords is not a mechanical process. It is sending message to your brain that you be prepared to listen to something similar or something related to this, right? Now, throughout your career as a medical student or as a nurse student or working as a nurse or a doctor, you have gathered so much of vocabulary related to it, right? So probably you don't need to learn any new vocabulary here. You just have to recall all the vocabularies that you are familiar with nephrology, right? Now let us analyze each of the section carefully. Now the first section here says symptoms. So definitely here the patient is going to describe the symptoms. Now we have a total of 6 points here and they are all related to symptoms. Okay. Now what we would do is for each of the blank, we would go on to predict what kind of answer could be there. Okay. We're going to predict whether it is going to be duration of the symptom, characteristic of the symptom, or related to which body part is it, or are we going to look at associated problems that this patient is having? Now, a lot of times what happens is students only read the questions which has a blank in it and they miss out the points which do not have any blank in it. Please don't do that because what may happen is the word is already given here and you may end up writing fatigue here, right? So be really careful about these points which do not have any blank in it. They are very useful in keeping the track of the conversation, and you also need to ensure that you don't repeat something which is already written there. Now, the second one, the first blank here says suddenly developed something. One more thing you need to remember is when the audio starts, the patient may not repeat these exact words. He would not say, I usually felt fatigued or I suddenly developed. Yes, this is your language. You, as a junior doctor, have written something like this, but patient would not be using the same language. They would be using their own language. So, suddenly developed what? I'm expecting a symptom here. Okay, and my keyword is suddenly because the patient may say all of a sudden. Okay, I woke up with, okay, then that was unexpected. So you may not hear the exact word sudden, but you may hear something similar to that. Then the second blank says blank in wrist and fingers. So wrist and fingers is my keyword, and it's already given no pain. Okay, so this is kind of a hint for me that answer for second one would not be pain. Okay, and it says oh, which means it has to be a countable noun here. Okay, because article is written there, and something that can be noticed. Pain cannot be noticed. Yes, it can be felt or experienced. Then it says experienced uncharacteristic. What do you mean by uncharacteristic? Uncharacteristic, any idea? Is anyone of you familiar with this term? Uncharacteristic, unidentified, yeah, unusual. So again, it is going to be a symptom that they experienced. So this time it is going to be a symptom that can be experienced, and not noticed. Yeah. Sometimes became blank. Here, can you predict what kind of word am I looking for? Will it be a noun or an adjective? Sometimes became. Try to frame any sentence with become. How do we form a sentence with become? Adjective. Very good. Yeah. So I'm expecting an adjective here. Okay. More often when you are having become before the blank, especially if it is in the symptom section or presenting complaint section, you're more often looking for an adjective. Okay. She has become pale. She has become tired, fatigued. So become is more often followed by an adjective. So you won't be writing tiredness. Sometimes became tiredness. No, sometimes became tired. Now here it says no exertion. So which complaint we usually relate with exertion? Yes, there are certain complaints which we often relate to exertion. We try and find out whether these problems are happening because of exertion or without exertion. What are those? Tachycardia, tachypnea, isn't it? Flutter, fibrillation, breathing difficulties. If these complaints are there, we often try to relate it to exertion, whether the patient is getting it because of exertion or whether they are getting it at rest as well. The chest pain related to angina. Okay, so I'm going to have something similar to that where we associate that problem with exertion. And finally, here says aware of. Okay, so whenever you have a preposition before the blank, again you would more often have a noun. Aware of what? Then the second heading says here preliminary investigations, which means this entire section is going to talk about the investigations, the investigation findings. Okay, so here if we see, it says CT scan and something carried out on kidneys. So again, I'm looking for a test here, a type of test that was done. So now when it comes to real exam, obviously you wouldn't have this much amount of time to write it. But in the beginning, when you are practicing in the beginners section or when you are learning, it's a good idea to write the expected word or the type of word that you are looking for. Okay, but in real exam, do not attempt to write it because then it would be very time consuming. How much time do you get for prediction in listening part A? You just get 30 seconds time, okay, before the audio starts. But if you also utilize the instructions time, then for listening part A1, extract 1, it would be on an average about 1 minute's time. or more than that, because initially you would hear these instructions. It would say this is occupational English test. It has 3 parts. Now, by the time you will go for the test, you will become familiar with this instructions. So what you can do is, instead of paying attention to the instructions, you can actually start reading the questions and predict the answers for it. But you definitely don't need to write it, because it is going to be very time consuming otherwise. And can any one of you tell me what kind of information am I predicting? For question number 7, it says possible link to blank was ruled out. What kind of word am I looking for? Am I looking for any investigation here? What kind of word am I looking for? To rule out is to exclude. Yes. So it says diagnosis. Yeah, I'm looking for a diagnosis. Okay. Or a disease condition that was ruled out. Okay. So investigations, if the heading is, it doesn't mean that all the blanks will be just investigations. Some of the blanks can also be talking about the result of that investigation. So here it says they did some test, the blood test, and they did also some tests to see if there was any protein deposits or amyloidosis was present there or not. And as a result, they were able to rule out possible link to something. So I'm looking for a diagnosis here. Then the treatment. Okay. Now in treatment it says cut down. To cut down is to reduce. Yes. Here I'm looking for some something related to food, or it could be smoking. Yes. Or it could be alcohol that the patient might have been told to reduce. Underwent, underwent, and the bracket says successful. So this has to be a procedure that they underwent. Then 10th says prescribed. So we use prescribe with medication. So I'm looking for a name of medication here. Okay. And the final heading here says further treatment option. So this treatment he has received so far, and this is for the future. Now it says possible blank discussed, which means a possible treatment option has already been discussed as your keyword here. So here I'm looking for a form of treatment. And for the next one, blank not required at present. Again, I'm looking for a form of treatment, but this time treatment that is not required. And for 11th, it is treatment which will be possibly taken into account for this patient. Right? So if I can just very quickly write these things as well. Here we were expecting a symptom. Then here our keyword is noticed and wrist and fingers. It should not be pain. Okay. Again, it has to be a sign, because noticed, then experienced. Here unusual is my keyword, and again I'm looking for a symptom that can be experienced. For 4th one, I'm looking for adjective. And for 5th one, I'm looking for a noun. What was he aware of? Remember, all the answers would come in sequence, but the sequence of words within that sentence can change. Okay, so patient may not say I suddenly developed nausea, but they would say I started experiencing nausea all of a sudden. So nausea may come first and sudden may come at the end. So you can't keep waiting only for the word sudden, that once they say sudden, only then my answer would come. No, right? You will have to take the whole sentence into account. Similarly, they might say wrist and fingers first and the symptom may come later on, whereas here you have the blank first and then wrist and finger. So be vigilant of that fact. Otherwise, all the answers would come in sequence. So you will have 2 people talking, the senior consultant, that is a nephrologist, and a patient. The nephrologist's role will be mainly to prompt patient to give information, but all your answers would be coming from patient, right? Because patient would be describing what he developed, what he noticed, what he experienced, how he feels sometimes. Similarly, all the blood test or other tests that he had so far before seeing the nephrologist, patient would be mentioning all these things. So be aware of this fact that majority of your answers are going to come from the patient, and the senior consultant would be only helping you to move from symptoms to investigations to treatment and to further treatment options. So what I'm going to do next is I'm going to play this audio. All of you would be able to hear this audio. Preferably, if you use headphones or earphones, you could have better experience of the audio quality. Uh, and you don't need to type your answers in the chat box. Please don't type your answers in the chat box. Just write it for yourself. And then I would be sharing answers here on screen when you would be able to compare your answers with this one. Okay. So now I'm going to play it.
So, Mr. Lucas, I have your notes here, but I wonder if you could tell me in your own words what's brought you here today.
Well, towards the end of last year, I had to take some time off work because I was absolutely exhausted. I didn't really know why. It was a level of tiredness I hadn't felt before. Then, one morning, I found I had slightly swollen legs. It was really alarming because it literally happened overnight. It wasn't like anything I'd experienced before. And it wasn't the only thing that was going on either. I had this strange tingling sensation in my wrist and some of my fingers, though, no actual pain.
I see. And were there any other symptoms?
Well, I used to love my food. In fact, one of my passions is cooking for friends and family. But I was suffering from a complete loss of appetite.
I see.
It wasn't like me at all. Generally, I didn't feel that well, and I wasn't in the mood for doing anything very much. Occasionally, I'd get short of breath, too. This could happen even when I wasn't doing any exercise or anything. A few times, I thought I noticed an irregular heartbeat. I was very worried about that.
Okay, so when you saw your GP, he wasn't sure what the problem was?
No, it was such a strange mixture of symptoms, though he reckoned there might be some problem with my kidneys. He said I needed to go and have some tests at the hospital, and that made me even more anxious, to be honest. Anyway, I had a CT scan and a biopsy to check things out. This showed that I'd got these protein deposits in my kidneys. I can't remember the name, though I was told stuff like that, actually.
Right, it's called an amyloid, but don't worry about the medical terms.
Okay.
Anyway, at this point, you had some other things checked out?
Yes. Fortunately, the blood tests I had didn't find the same build-up of protein in the heart. That was a relief, because apparently that's much more difficult to treat.
Yes, indeed, that's true. And I understand that it was confirmed that your condition was unrelated to anything else.
I was told that sometimes what I've got is a sign of a type of bone cancer, but I was given the all clear as far as that was concerned.
Okay. Now, as soon as the diagnosis was made, you were given some detailed advice regarding your diet. Is that right?
Yes, I had to reduce my salt intake more or less immediately. I found it a bit hard at first. Having to avoid a lot of recipes that I normally enjoy and having to think carefully about everything I ate and how much. And then, as you know, I had my first session of chemotherapy last month. It wasn't pleasant, but at least it seemed to be reasonably successful. I was told that it wouldn't be enough on its own, though, that I had to take steroids at the same time. It's been a difficult time. I felt really ill after this initial round of treatment, and it was some time before I was back on my feet.
Well, I believe my colleague has discussed with you the fact that we need to run regular tests to check the levels of amyloid deposits in your kidneys.
Yeah.
The problem can recur, but hopefully it's under control at the moment.
Oh, that's good news. I know there's probably no actual cure for this condition, but your colleague talked about maybe having a stem cell transplant in the future. He explained to me in detail the ins and outs of the treatment. I was relieved that no dialysis would be necessary. Fortunately, it seems the problem has been caught early enough to avoid that.
No, you haven't had anything like complete kidney failure, though we need to keep a careful eye on this. So what we need to talk about today, Mr. Lucas, is some further medication.
Okay, so since I see a lot of you here have been doing this for the first time, now I'm going to repeat this for the second time. In case if you have missed any of the questions, try to write them down now. I'm going to play it once again.
For you then. So, Mr. Lucas, I have your notes here, but I wonder if you could tell me in your own words what's brought you here today.
Well, towards the end of last year, I had to take some time off work because I was absolutely exhausted. I didn't really know why. It was a level of tiredness I hadn't felt before. Then, one morning, I found I had slightly swollen legs. It was really alarming because it literally happened overnight. It wasn't like anything I'd experienced before. And it wasn't the only thing that was going on either. I had this strange tingling sensation in my wrist and some of my fingers, though, no actual pain.
I see. And were there any other symptoms?
Well, I used to love my food. In fact, one of my passions is cooking for friends and family. But I was suffering from a complete loss of appetite.
I see.
It wasn't like me at all. Generally, I didn't feel that well, and I wasn't in the mood for doing anything very much. Occasionally, I'd get short of breath, too. This could happen even when I wasn't doing any exercise or anything. A few times I thought I noticed an irregular heartbeat. I was very worried about that.
Okay, so when you saw your GP, he wasn't sure what the problem was?
No, it was such a strange mixture of symptoms, though he reckoned there might be some problem with my kidneys. He said I needed to go and have some tests at the hospital, and that made me even more anxious, to be honest. Anyway, I had a CT scan and a biopsy to check things out. This showed that I'd got these protein deposits in my kidneys. I can't remember the name, though I was told stuff like that, actually.
Right, it's called an amyloid, but don't worry about the medical terms.
Okay.
Anyway, at this point, you had some other things checked out?
Yes. Fortunately, the blood tests I had didn't find the same build-up of protein in the heart. That was a relief, because apparently that's much more difficult to treat.
Yes, indeed, that's true. And I understand that it was confirmed that your condition was unrelated to anything else.
I was told that sometimes what I've got is a sign of a type of bone cancer, but I was given the all clear as far as that was concerned.
Okay. Now, as soon as the diagnosis was made, you were given some detailed advice regarding your diet. Is that right?
Yes, I had to reduce my salt intake more or less immediately. I found it a bit hard at first. Having to avoid a lot of recipes that I normally enjoy and having to think carefully about everything I ate and how much. And then, as you know, I had my first session of chemotherapy last month. It wasn't pleasant, but at least it seemed to be reasonably successful. I was told that it wouldn't be enough on its own, though, that I had to take steroids at the same time. It's been a difficult time. I felt really ill after this initial round of treatment, and it was some time before I was back on my feet.
Well, I believe my colleague has discussed with you the fact that we need to run regular tests to check the levels of amyloid deposits in your kidneys.
Yeah.
The problem can recur, but hopefully it's under control at the moment.
Oh, that's good news. I know there's probably no actual cure for this condition, but your colleague talked about maybe having a stem cell transplant in the future. He explained to me in detail the ins and outs of the treatment. I was relieved that no dialysis would be necessary. Fortunately, it seems the problem has been caught early enough to avoid that.
No, you haven't had anything like complete kidney failure, though. We need to keep a careful eye on this. So, what we need to talk about today, Mr. Lucas, is some further medication for you.
Okay, so give me a moment. I will be getting the answers on screen. Okay, so hopefully all of you can see the answers on screen. I want you to match your answers with this. Don't worry about the spelling. In the listening part A test, you're not penalized for spelling errors as long as the meaning or the sound is the same. Okay, so homonyms are fine. If you are, if the sound, if you have picked up the correct sound, it is fine. And all the words that are written in the, under the bracket are optional. Okay, so if you have missed those words, then that's absolutely fine. Let me know how many answers could you get correct. How many had you missed? If in case you had missed any of the questions, let me know. Yeah, that's wrong because the abnormality is irregular heartbeat, right? We all are aware of our regular heartbeats, but he was aware of irregular heartbeats. So irregular is necessary here. Otherwise, very good, Amita. Very good, Akshar. Meet, great. Very good. How about others? Okay, not bad, Poonam. Akshana, very good. 11. Wow, great. Okay, so it seems all of you did really well in this part of the test. Does any one of you you want me to explain any of the answer here? Yeah, so that was the mistake in picking up the correct sound. It's ball cancer, ball cancer, and this is bone cancer, right? So you could not pick up the correct sound. That was probably the error. In order to improve your awareness of sounds, what you can do is, in addition to the beginners or intermediate tests that have been given to you, we have also included some of the extra practice audios. They are just the audios and the transcripts. You just need to listen to them and keep the transcript in front of you while you are listening. That would definitely improve your awareness of picking up the correct sounds. You will become more familiar with the sounds. Okay, Aldrina got 8 correct. That's probably Aldrina, because you haven't yet started practicing for the listening part A. So make sure that once we have learned or discussed the strategies today, you are going back and practicing more tests from the beginners section. That would definitely help you gain more control over the audio, being able to focus when the audio is going on, your ability to concentrate would improve. And at the same time, your ability to predict the type of information you are looking for. That's the key, right? Just like the example that I give you all the time, if I'm aware of what I want to purchase, it would be really easy for me to buy that product. It wouldn't take much time. But if I don't know what am I looking for, I may waste a lot of time and then ultimately don't purchase what exactly I want to purchase. So the same thing goes here as well, particularly with the listening. Okay, because the audio is played once only, you can't pause it, you can't go back, you can't stop it. So you have to be really prepared when the audio starts. So a lot of research has proven that only those students who can do the pre-listening well succeed in these kind of exams. Okay, so your prediction plays an important role. That is the reason when you are doing the beginner's test, it is not necessary for you to take only 30 seconds before the audio starts. You can take 1 or 2 minutes time, understand the notes in detail, predict each type of word, write it down. That's perfectly fine when you are at the beginner's stage. Write it down so that once the audio starts, you know exactly what to listen for. Okay, and once you practice in that direction, definitely your score will improve. Make sure that whenever we do any of the strategies in the class, the online one or in class one, you are going back and practicing the same module at home as well. It could be from beginner's test or from intermediate test. That is going to give you more clearer idea and hands-on practice on how to solve this type of tasks. How about Princey and Viraj? I haven't received your scores as yet. How much did both of you score? Okay, that's kind of a very low score, Viraj, 4 wrong. But yeah, keeping in mind that you haven't practiced as yet, can you just tell me which all answers were wrong for you? You missed three? Okay, that's the reason. So you couldn't pick up when I played it for the second time as well? Not in the second time as well? No. Okay. Okay. So what you can do is again you can practice this particular test and you can pause exactly where you're not able to understand. Try to pause them and be familiar with those sounds. That could probably help you. How about Princey? How many questions were correct for you, Princey? Okay. Okay, so now we are going to do the second extract. Now for the second extract, I want you to predict. Okay, so I will be having that question or those notes on screen for about 1.5 to 2 minutes, and I want you to predict for each of the question, and then I would be playing the audio so that you can get a practice on predicting it. Yeah, so fifth one, as I said, the abnormality is that he has irregular heartbeat. So being aware of heartbeat is not an abnormal sign. You were looking for abnormality. Yes. So just writing heartbeat wouldn't help. You need to write irregular heartbeat. Only then it is correct. Okay. Now let's do the second extract. I've got it here on screen. Read the context sentence first that would give you an idea as to what this entire talk is all about. So it says a neurologist, okay, and you have the notes here. Pay attention to the subheadings, okay, and then look at each question and try and predict the type of information that you are looking for. If you are doing this for the first or the second time, try to actually write it down in your notebook for each blank what kind of information you are looking for. And what are the keywords that may help you pick that up. So here increased incidence of is your keyword, and whenever you have preposition before the blank, you are always looking for a noun. And it is incidence, which means you are looking for something which happens in episodes, and it is noticed, not experienced. These verbs can be really helpful. Okay, what can you notice and what can you experience? For example, if it is pain, headache, then it is experienced, you don't note it. Then the second one says went to optician, inflammation in both eyes. So this, you don't need to write anything here. Sometimes had spots that looked like. Here, what kind of word am I looking for 14th one? Spots that looked like. Looked like. Comparison. Yeah, so I'm looking for an adjective here. Again, adjective for spots. They are, yeah, I'm sorry, not the adjective, but something similar to spots. Then later had blank on leg. So leg is my keyword. I'm looking for a symptom, but that symptom should not be swelling or anything related to swelling, because the swelling is already given here. Then here for 16th one, it's related to skin. Skin left permanently. So here he is describing that he had some spots. Yes. And then because of that spots, his skin became how? So here I'm actually looking for an adjective. What kind of adjectives do we use for skin? Can anyone of you predict that? But it says skin left permanently. So it is less likely to be a sensation. I'm using adjective for skin. So damaged, yeah. What else? What else? It permanently became what? What are the common abnormalities related to skin? It may become rough, yeah. Maybe the color may change permanently. Yes. So I'm looking for adjectives probably that describe more of an appearance of the skin. Then headaches. So that is already given. So see, this is sketchy, okay? Thought he might be developing. Here you may end up writing headaches, but headaches is already given. And it says thought he might be developing. So what kind of word am I looking for in 17th? What type of information? He thought he might be developing. He did not experience that. He did not notice that. But he thought a symptom I cannot think of symptoms, right? Symptoms I experience. Skin conditions, yeah, it could be actually a disease. Yes, I have a symptom and then I think that it could be related to this disease. So I'm looking for a disease condition. Yeah, exactly, disease condition. Okay. Then he is going on to describe further information that they were intermittent, and he also believed that diet was causing the problem. Then second heading is diagnosis. Again here it says GP thought it could be. Okay, so in GP's opinion, again I'm looking for a disease here, and here it says blank confirmed diagnosis. What kind of information am I looking for here? Can any one of you predict for 19? Test, yeah. Which test confirmed the diagnosis, right? Here I'm not looking for diagnosis. I'm looking for a test that confirmed diagnosis. Then this is pretty simple, medicine. Then next one is side effect and currently trying. So here it has to be again one of the treatments or therapies, and my key here is no side effects reported. So this has to be different from the medication that he discussed earlier, right? And now again for the treatment, we'll see ophthalmologist for administration of what? So here what do you predict? Ophthalmologist and administration of, what do we administer usually? Yeah, it could be some sort of ointment or drops. And finally, again, to deal with increasing number of headaches, so I'm looking for medicine. What medicine has been prescribed, right? So when you are doing the beginner's test, please make sure that you are doing such a thorough and detailed pre-listening. Otherwise, what would happen is you did one test, okay, like there are 8 correct, let me do one more test. Again, you will see 8 correct, next test, 8 correct, and you will exploit all of the test and you would not get or you would not see any improvement in your performance. So please don't do that. Instead of that, analyze the test in detail, do such a detailed pre-listening, then do it. See how many questions you could not pick up. Don't look at the answers until you have got all 12 answers written, at least written. It may be wrong, that's fine, but you should not miss anything, or you should not compare it with your answers until you have got all 12 answers written. Okay, so play it twice, thrice, as many times as you want when you are at the beginner's level. That's perfectly fine, right? Because in the beginning only, if I try to ride the car at the speed of 100, I'm definitely going to meet with an accident. So you are still learning how to do it, and you don't need to follow the exact 30 seconds timeline when you are learning it. So take as much time as you need, but do a thorough pre-listening, then only play it. Play it twice, thrice, as many times as you want, but you should be getting all 12 answers. Once you have got all 12 answers written, then check it whether they are correct or incorrect. And when they are incorrect, also check where you went wrong. Have you written something that has already been given there? Were you not able to understand the question? Were you not able to understand what type of information is to be written there. Again, check the transcript. So for beginners and intermediate, for both of those tests, we have also provided you with the transcript. So please check it with the transcript as well, whether your answers are correct or incorrect, or where you went wrong. Then only move on to the next test. Okay? Exploit one test fully before you move on to the next one. So now I'm going to play this audio. This time I will be playing it once only. So make sure that you are able to write all the answers in one go. If you miss any of the answer, don't get stuck on one question. Just move on to the next and try to answer as many as you can.
First, I need to get an overview of how your condition has developed. Can you just describe for me the initial symptoms?
Well, it's a long story, and it took ages to get a diagnosis. It's been very difficult to cope with.
I totally understand your frustration.
There were quite a few symptoms, but I didn't connect them all at first. I had 3 or 4 separate lots of mouth ulcers in the space of less than a year. They were quite painful, and I couldn't eat properly.
Okay.
I've occasionally had them in the past, but not as numerous and frequent as this. Then in June last year, I suffered from this really bad inflammation of both eyes. I went along to my optician and he gave me something for it and said it would settle down.
And did it?
Actually, yes. That's been one of the weird things about all my symptoms. They flare up and then sort of disappear after a while. And I rarely had all the symptoms going at the same time, thank goodness. Once or twice I came out in spots, and it brought back unhappy memories of acne when I was a teenager. Around the same time, I noticed these slight skin lesions on my leg. The skin was red and felt very tender. Even after the swelling had gone down, the skin looked odd, quite discoloured.
Okay.
And it still is. I can show you.
Were there any other symptoms?
Well, I started getting these awful headaches. One of them really knocked me flat for a whole day.
Okay.
The only other thing was a definite stiffness in the joints. My mother had arthritis, so I thought I had the same problem too, but again, like a lot of the other stuff I'm telling you, it sort of went away without any treatment. At this stage, I was sure it was my diet that was causing all these problems and thought some food types might be triggering some of the symptoms.
And what did your GP say when you saw him?
He ordered various blood and urine tests, and at one point he thought I might have contracted Lyme disease because I do enjoy my walks in the countryside, and a couple of the symptoms seemed similar. The test didn't point to anything.
Right.
I saw a different doctor and he speculated about possible lupus and explained what it was. He wasn't totally convinced, though. The lack of certainty was upsetting and just made matters worse.
And then you had further tests?
Yeah, the diagnosis became more definite when they did a pathogy test. I had such a strong reaction that it seemed to be like the final piece in the jigsaw puzzle.
Right. And then you were referred here?
Yes, and I've had to see various specialists to deal with the different symptoms. I was given some immunosuppressants straight away, though they did warn me that there was the possibility of side effects. I know it can be like that with almost every drug, but I didn't expect to suffer the way I did. Basically, I had a lot of abdominal pain, and would you believe it, some of my hair started to drop out.
Right. So that treatment was discontinued?
Yes, I was told that biological therapies would probably be more effective. Is that right? I haven't reacted in the same way to this new treatment, at least not so far. There have certainly been no strange side effects. I feel a little better overall.
Okay. Now, I believe you're seeing the ophthalmologist this morning.
Yeah, she's going to give me some corticosteroid eye drops. And the other urgent problem right now is getting to grips with the headaches. Your colleagues have put me on beta blockers. I'm hoping they'll prevent these headaches developing in the first place.
Yes, they should work well. Now, we just need to discuss your recurring joint pain and see what we can do to ease that.
Okay, so now I will be getting the answers for this one. Hopefully you can see the answers. Yeah. Okay. Again, don't worry about the spellings as long as the meaning is correct. For example, here if you have written pathology test, it is wrong because the sound changes. There was no l sound there. It is pathology, pathology. And if you have um, written, say for example, here, if you have just written lesions, it is fine. Skin is optional. Let me know how many of your answers are correct. How many have you missed? Um, Missed 3 answers. Okay. Missed 4. Okay. Missed first one. Fair enough. Okay. Yeah. This, I can see this time more answers are incorrect. That's probably because I was not able to play it, or I didn't play it twice. So this kind of reflects your actual level, because in exam also you would be listening to it once only. And that's missing 3 or 4 answers, uh, particularly for Akshana, Aldrina, Viraj, uh, Yachana, even Amita to a certain extent is fine, because you are still in the beginning, you are still learning how to approach it. But those of you who have been practicing for more than 6 months, if you missed 3 or 4, that's really bad. That shows that you have not been able to improve even a little bit. Okay, so that's really bad. But for those who are beginners, don't worry too much. It would definitely improve. Particularly, I'm very much sure if you will complete the beginners practice test, your score will at least improve at to a level where you would not be missing anything. It could still be 1 or 2 answers wrong, but at least you would develop that level of concentration or ability to follow, as well as writing speed by the time you will finish beginners, that you would definitely be able to write all the answers. Okay, so don't worry at all about it. How much you are targeting in part A is, you are at least, you should be able to get 18 to 20 correct. Okay, out of 24 questions. The more you get correct, the less you will have to worry about part B and part C. Okay. Part A is the key to pass the listening test. The better your performance in part A, the lesser you will have to worry about part B and part C. So work hard on part A. Listen to as many consultations as you can. There are a couple of good websites or YouTube channels where you can listen to these kind of consultations. I would give you some of them. For example, you can refer Aurora Medical Education. This is a very good YouTube channel to refer to. You can refer to Mentor CSA consultations, and any of, please don't type OET speaking or OET listening, because the stuff that you will get because of OET listening will be not the very standard or authentic stuff. Instead of that, listen to these websites, and I can guarantee that you will be getting a very good standard accent, which would help you improve your listening skills, particularly for certain sounds which are pronounced differently in different accents. Like, for example, pathology test, that probably could be an issue for a lot of you. Similarly, in the first one, it was bone cancer and not ball cancer. So listening to these consultations will definitely improve your familiarity of different accents. And this is in addition to what we have already given. In Teachable, you have a lot of stuff to improve your listening. So beginners test definitely you have. In addition to that, as I said, 15 tests are given there, wherein they are not actual tests. You just have the consultations and the transcript, which is going to be very useful. So you need to listen to those audios and keep the transcript in front of you so that you can actually follow what are they speaking. Yeah. So if you will be able to follow this much, definitely it would improve. Listening and reading is a receptive skill, that is something you develop or build over a period of time. Okay. And if you have set a short period for yourself, then you need to rush a little bit so that you can get maximum exposure. And that is known as binge listening, right? So instead of now binge watching any web series, binge listen to instead of web series, binge listen to the consultations on YouTube. And this will be helpful for both the things, for listening as well as for speaking. Because what you have to do in speaking is take a consultation, right? Talk to your patient. And that is the reason why I encourage you not to type OET when you are searching on YouTube. Instead, type consultations or CSA consultations or USMLE consultations. You will get standard stuff there and very good resources for improving your speaking skill as well. Okay, so that is my advice for those of you who missed a couple of questions. That's absolutely fine. It is not uh, something which cannot be worked on or which cannot be improved on. It can be definitely improved with practice in the right direction. Okay, so one of the other things I wanted to show all of you is the use of phrasal verbs. So what I'm going to do next is I'm going to get the transcript on screen, and with the help of transcript I would explain you how the language, another reason why you often miss the words or often miss the answers is because you are not familiar with the patient's language. You don't know how the patient is going to describe it. So being familiar with the patient's language could be another very good way of improving your listening part A score. So I'm going to list a few phrasal verbs here that were used by the patient. I want you to note them down, the phrasal verbs as well as its meaning. Okay. So here the first one, the patient said, time of work. Time of work. This means to take a leave. To take a leave, right? Then in the question paper you had fatigued, but patient said exhausted. So they are synonymous. Then it said suddenly developed. So the patient has said here that it happened overnight. Yeah? So patient didn't use the exact word suddenly developed, but he said it happened overnight. So you get to know that it developed suddenly. So these are a few phrasal verbs. There are a lot in all of these tests, and you can do the same process when you are practicing from the beginner or intermediate. Try and find out which phrasal verbs were used by the patient for describing symptoms. Okay, so in this part you don't have any word. Okay, to reckon is to strongly believe something, is to reckon. Right? Now the patient would never say I underwent or I was tested for. They would say I had, to check thing out, to assess, to find out. Okay, let us find out other phrasal verbs. Yeah, look at this. The patient didn't say the link was ruled out, but he said all clear. To give all clear means to say that there is no abnormality, is to give all clear. I'm sure all of you are noting this down. These are very useful phrasal verbs. To be back on someone's feet, back on my feet is to be normal again, or to be able to live a normal life. This is pretty simple, very easy to understand. But it's important to understand that it has nothing to do with the back or nothing to do with the feet, right? It's kind of an idiom to say that I'm back on my feet is I'm independent again or I'm normal again. It has nothing to do with the back or the feet. So this kind of words can create confusion if you are not familiar with this kind of phrasal verbs. Similarly, the patient said, the doctor said here, we need to run regular tests. Instead of saying, you need to conduct test or you need to undergo test, we need to run some test. Again, very commonly used phrasal verbs. To run some test is to do some test. And yeah, ins and outs of the treatment. Ins and outs of something is to give detailed explanation, like she knows ins and outs of the airline, for example. Okay, so they know everything in detail about the airline. So to know ins and outs of something. To catch something early is to diagnose something early. The problem has been caught early enough, caught early enough, was diagnosed early enough. So this is another activity you can do uh, to improve your understanding of patients' language, because their way of describing symptoms will be different than what you have learned in your textbooks. And then keep a careful eye. To keep an eye on something is to monitor something. To keep an eye on something. We need to keep an eye on your blood pressure, means we need to keep an eye. We need to monitor your blood pressure. Similarly, let us look at the second transcript. That too has phrasal verbs in it. And for this reason only, we have provided all the transcripts to you so that you can refer to them and learn few words from it. So first one here is to cope with. To cope with is to adjust, to manage something. So there it said increased incidence of something, but the patient said that, but not as numerous and frequent as this. Right? So a very different way of describing the symptom. Then settle down. To settle down is to resolve, but patient would never say that it resolved or it was cured. That is how the healthcare professional would say, but patient would say it settled down. Then to flare up is to exacerbate or to worsen. Again, patients would not say my condition has worsened, but they would say I often get this flare up. Isn't that visible? That's simply an expression, space of less than a year. So that was happening in a year. Then to come out. Okay, again, patients would never say I developed spots. They would say I came out in hives. I came out in something is to develop. Then brought back memories, to recall memories. Then swelling had gone down instead of reduced. So these are the words that you need to get familiar with to improve. Similarly, went away without any treatment rather than saying recovered without any treatment. That is why OET tries to give you authentic practice, which means these consultations are real consultations. They are not recorded for the test purpose. Okay? So this, if you are familiar to understand this language, it can ensure to GMC, to NMC, or to AFRA that you will be able to understand those native speakers as well. See how crucial it is, because if you don't understand what they are saying, you may end up giving wrong treatment to them or wrong care to them. Right? So this is very important that you are able to understand their language clearly, and particularly the patient's way of describing language, which includes a lot of phrasal verbs. I think this particular test has this many phrasal verbs. I don't see any other phrasal verbs here. But yes, definitely you can find a lot of them in all the transcripts of listening part A. So make sure whenever you are practicing any of the tests, as I say, don't just move on to the next one. Study one test fully. See, again a phrasal verb. He prescribed, but the patient would say he put me on. He put me on. Now, it is not actually putting something on someone, but it is starting a treatment. Okay. So I think all these tips will definitely help you improve your performance in listening part A. One is to listen to as much as you can, binge listening. Two, if you're practicing from beginners or from extra practice, then keep the transcript in front of you or study the transcript afterwards. Make a list of phrasal verbs and its meaning so that you get more and more familiar with the patient's kind of language. If you follow all these things, then your score in listening part A would definitely improve. And whether you pass or fail the listening test depends entirely on how well you did in part A. It is that important. So make sure that you are practicing uh, this listening part A really well. Yes, you can definitely use these phrasal verbs in speaking, but make sure you are not using them in writing. Spoken and written language are different. So whatever you get from the transcripts here, you can definitely use it in speaking. But in writing, don't say, please keep an eye on his blood pressure. That's not correct. You can't use spoken language in writing. Okay, so is that all clear for part A? Just let me know. Any questions? Shall I move to part B? Any questions related to part A? You don't need to transfer your answer anywhere. You will be writing your answers directly in the question paper itself, and the same question paper is going to be submitted. You don't need to transfer your answer anywhere. You don't get any extra time after listening part A. As soon as the listening part A ends, you will start with part B. Okay, so make sure you're writing your answers fully. Okay, and if in case if it is going very fast and if you are not able to write it fully, make sure at least you have written some hint for yourself. For example, if it says corticosteroid eye drops, okay, so I would write cortico and then I'll leave some space and then I would write st and then I would write I. So what I can do is after the entire listening test ends, I will be getting 2 minutes time. Part A, Part B, Part C. Once the whole test ends, I will be getting 2 minutes time. So during that 2 minutes time, I can come back to this and complete it, right? But write something. If you don't write anything, there are very high chances that you would forget what was supposed to be written there. So write something, write some clues for yourself so that you don't completely forget it. Okay, so now let us move on to listening part B.